Good afternoon, everyone, and welcome to today's edition of the Black Health Trust. I am really happy that we're coming together today because I think all of us, or I'm suspecting that many of us are feeling the need to gather together and figure out where we're going to go from here. And without further ado, I'm going to turn it over to our founder, Dr. Randall Maxick.
Thank you very much, Dr. Barbara Nabert-Stephens, MD pediatrician, longtime friend of mine, Dr. Ivan Walks, psychiatrist, and my personal caretaker, and Dr. Hines, who may be joining us, and of course, Simon, our technician. I spent the past few days somewhat depressed, somewhat put off about the clarity of the decisions that were done by our Supreme Court. And I'm sure we all know that they have put a damper on what we call the way we were able to raise ourselves up by getting into schools, by having people that look like us become higher educated, having more physicians and providers. And of course, this has a effect on our health, and the number of healthcare providers we have, and it has an effect on our health. And I was initially depressed, and I spoke at length with Dr. Nabert-Stephens about why I was embittered. And then I spoke with a pastor friend of mine who is probably one of the smartest men that I know, who's a retired AME preacher in Atlanta named Dr. Shaveen Jones, who happens to have a master's in both Greek and Hebrew. And we talked about what would be the Christian response when you're angry with the brothers and sisters that make up the ruling people in your country. And he straightened me out. He said, first of all, it's going to work out. Second of all, there are things that we need to do to take care of ourselves and not leave it to other people to take care of. And in my conversation with him and then with Dr. Nabert, we decided there are things we have to do no matter what. I used to be a football fan, and we know that back in the 50s, 60s, and 70s, it was the ground game. Ohio State was 10 yards and a cloud of dust. What are the things that we need to do to take care of our own health, to take care of our own communities, to take care of ourselves? We were the first people on this earth, and we survived all sorts of things. We were brought to the continent of America, I guess that's the name of it, and we survived through 400 plus years of slavery, and we're going to survive now. But it'll be not because somebody gave it to us, but because we took charge ourselves. I have a few slides that I'm going to go through as a point of discussion. It's not going to be a lecture. And I also had a very interesting letter, touching letter from one of our regular attendees about what should we teach on the Black Health Trust. Many times we give these high-powered lectures, but we don't tell patients what they should advocate for, what the questions they should ask when they go to a physician. So having said that, let's go to the first slide. I'm going to talk for a couple of minutes. I'm going to ask Dr. Nabert-Stephens and Dr. Walks to assist me in visualizing a couple of these slides. If you start, Simon, with the first slide.
The Supreme Court decision restricting medical schools' ability to consider race in admission decisions is bad for healthcare, bad for medicine, and undermines the health of our nation, according to a statement from the American Medical Association.
Go ahead.
Health disparities are perhaps our most profound evidence of America's continued need for affirmative action in higher education. It is with the highest hopes for the health of our nation that we stand in firm disagreement to this ruling and urge executive action as a bridge to eventual legislative remedy.
Now, these are the two major organizations in medicine, the AMA, which was, of course, the first that prevented Black physicians from joining in 1895, which resulted in the formation of the National Medical Association. The Cobb Institute, which is an affiliate of the National Medical Association in honor of Dr. Montague Cobb, put out that statement. Both were in agreement that this is not good for your health because we do need physicians and providers that look like us to provide for us. Let's go to the next slide. So there is a political and clinical basis of health disparities. There are some realistic solutions we need to speak about. Next slide. Barbara, could you unpack this one?
Health disparities, the tip of the iceberg, access and environment, discrimination, bias, cultural competence, racism. Underneath that cloud of the tip, we have social disparities, health disparities, economic disparities, empowerment disparities.
Let's go to the next slide.
The Institute of Medicine report, Unequal Treatment, stated racial and ethnic disparities in healthcare exist regardless of socioeconomic status. Poor quality of health, poor quality of care, and worse outcomes.
And I think the key word for me there is regardless of socioeconomic status. You don't have to be poor and in a ghetto. I examined the almost 500 members of a group called the Black Executive, Executive Leadership Council. And these are the top money earners in the country. But their problems with medicine, their problems with their health, diabetes, hypertension, was no different than people in the poorest community in the country. So it's not socioeconomic status. Next slide.
This is a letter. I appreciate the information that you all provide on a weekly basis. Sometimes it's very helpful. I have sent the link to my church health ministry and to some friends and healthcare worker friends as well. I have not seen them on the meetings though. The only thing I wish you all did a bit more of is to help us lay people know what to do when we are at a doctor's office. As someone said in the last meeting, we as lay people should not have to know what tests to ask for and what symptoms are significant to a doctor when trying to diagnose us, but it appears that is what is required in this day of some doctors who provide unequal health care and doctors that are just not as adequately trained. Helping us to be our own advocate is something we need help with. I can say something is not right, but if the doctor says it is okay, then I am not sure what else to do or say. If you can include that in your weekly presentations and/or have a few sessions on that, it would be greatly appreciated.
Next slide.
Your ground game. Number 1, yourself. Number 2, your family. Number 3, your community and environment. Number 4, your nation and our world.
Next slide.
You need a primary care provider. I'm smiling because I'm thinking about Dr. Jordan. Interview them. It's very important.
So let's stop right here and just talk about what we've talked about so far, and let's open to not only our moderators, but people who might want to comment about what we know happened in the past few days with the Supreme Court and how it affects us. But from my view, we know that if we don't look out for ourselves, nobody else is going to look out for us. In my opinion, from the reading that I've done, and there's a book that I surveyed this week called War on the Weak. And in that book, they talked about things that had to do with not only sterilization by not only Black people, but anybody that they thought would bring a bad outcome to the white race. They talked about eugenics. They talked about ways to make sure, even in the white evangelical church, that they stayed purely white. So we know that we have to look out for ourselves no matter what. One of the things that I've had struggles with is integration. Before integration, even though there were some bad things, inside our community, we had more education, more wealth, more family. And when integration came, it diluted much of the progress that we had made. But we do know that you must take care of yourself first, your family, your community, and your world. And let's open the mic from there about what is the ground game that we need to do past that. We have to be healthy. What is the ground game? Dr. Nabus-Stevens?
Well, I want to respond to a comment that one of our loyal members of our family put in the chat, Ms. Tanner. She asked, what are the questions to ask at the interview? But I want to address how you can even get to do the interview. Now, I have been very fortunate up to this point. I don't have many medical needs and don't call upon physicians that often, but I have assisted many people, including my own grown children, who participate in the marketplace insurance market, which I think a lot of people, as I know millions of people in this country participate in. Those marketplace plans tend to do things at the bare bone, including staffing or including people in their networks, which is to say that those providers in those networks are busy all day long. Let me be very careful here. In many of these plans, it is very unusual for you to actually see a physician. The care in many of these marketplace plans is provided by physician extender providers. And even when you ask for, let's say you're a female and you ask for a female physician, you still are not going to get a physician. You're going to get assigned to an extender provider who may or may not be of the preference that you have expressed. So before we get to the interview, we got to talk about demanding access to what you are entitled to. Look at those plans, see who the providers are, identify who you want to interview, and then be prepared, I'm sad to say, but be prepared to be extremely aggressive in getting the opportunity to talk to them in the first place. Now, so that's the first battle you're going to have to wage. After succeeding in that battle, now we can talk about the questions. And I'll pass it on to Dr. Walks after making those very inflammatory statements.
And in that process, we can go to the slides too. I think I addressed some of that. Go ahead, Dr. Walks.
So, first of all, Dr. Neighbor-Stephens, the truth is often inflammatory. And we just have to make sure that we are willing to deal with the fire that we start. The insurance issue, the structure of medicine is very, very off-putting. It's off-putting for folks who are not doctors. It's off-putting for doctors. I know doctors that are working and have insurance and are trying to make their way through. And here's a comment I often get. If it's hard for us, how must it be for other people? Well, the answer is it's crazy hard for other people. And so it is important for us to recognize that it's a challenge, and it's important enough, and it's important for us to recognize that it's an important challenge for us to face. And then one of the things that that Dr. Maxey mentions quite a bit is that he is willing to be somebody's Uncle Randall because people treat you differently when you have someone who is a professional healthcare person, doctor or nurse or other, who can understand some of the jargon that doctors use. So let me get to one answer to the basic question of what questions do you ask when you interview someone. You can start off very nice and very gentle and just ask them, I want to know what the process is for working with you. How will I get an appointment? How long does it take to get an appointment? I know doctors who are happy to take a new patient, but their next available appointment is 3 months from now. Well, you know, if you can just put everything on ice for 3 months, maybe that's fine, but maybe that's not. Some doctors will say, well, we can never return a phone call. You know, when you call, you'll get the advice person, some other practitioner. So getting to talk to your doctor maybe 10 minutes twice a year, if you can get to the doctor, as Dr. Neighbor-Stephens just pointed out. So, and then the most important thing I think is when you're asking questions about how things will work with that doctor, what kind of access you will have, is listen to that individual. Does it seem like it's a bother to them to answer some basic questions about how things work? Do they seem like they really are going to be a caring person? It's something that we sort of take for granted, that everybody is less friendly, but being kind, being friendly, being able to talk to people in a human way, showing them some value. Dr. Maxey mentioned earlier that he had talked to someone who was a pastor. And I always remember that you don't have to impress people so much with what you know, but there's an old song we sang back in Sunday school called "They'll Know We're Christians by Our Love." You don't have to beat somebody over the head with how smart you are. Sometimes you can just talk to people in a human way and let them know that you care about them and you value them. And so I would listen for that in that interview. Do you get any sense from the doctor that this is someone who is going to actually care for you and care about you? I can go on and on for the next 2 or 3 hours because I am tired of folks thinking that just because they're really, really smart and they went to medical school, that they don't have to be nice to people. That it's not okay. I'll stop there.
One thing also, Dr. Walks, even with these health plans, I believe that Dr. Neighbor-Stephens, if you don't like the person, they assign you randomly to somebody. If you go and see them and that's not somebody you can vibe with, you have the right to request somebody else to be your primary care doctor. Am I correct on that?
Absolutely. And in many types, especially the Medicare plans, well, even the Medicaid plans, the regulations say that members have an opportunity must be given an opportunity to select their provider. And and they frequently will assign and ignore your request. You certainly have every right to call and demand a change. But even if that didn't happen, if you just want to change providers, you have that right, and you need to hold their feet to the fire in providing you with the change.
So let's go back to the slide before this one where we said the ground game. I want to spend a few minutes talking about that. You can't have any game that you have any chance of surviving and winning if you're not healthy, if you're not motivated, if you're not mentally competent. Your first obligation, of course, is to yourself. Your second is to your family. They fit together. And you have an obligation to your community and to your environment and to your nation. And I put that number 4 in there. After I was embittered for a few minutes, it occurred to me that mentally, if my ancestors helped build this place under the circumstance they did, why would I let anybody tell me that this is not my country or I'm not welcome here? It's not going to happen. So we have to have a ground game that includes health, it includes politics, it includes voting, it includes voting at the community level, the city level, the state level, and the national level. We tend to only vote when it comes to somebody running for president. And as you can see in the past few days, the president doesn't have all that much effect when it comes to things that you or I might want to do. So it takes that ground game that we have to do. Let's comment on what the ground game is we need to do for a bit. And let's start with you, Dr. Nabert.
Thank you. I'd like to share, I've been thinking about this a lot this week, as I'm sure all of us have been, as I said earlier. And I'm a history major, so I tend to reflect on what has happened before, what the result of those efforts were, and if there's anything to gain from that, move to address whatever the issue is that we're currently facing. My thoughts turned to Ada B. Wells Barnett, who is a fabulous figure in our history. And if you're not familiar with her, I encourage you to do some reading on Ada B. Wells. But I want to share with you 3 things that she said that I take courage from, encouragement from, and hope. She said, the way to right wrongs is to shine the light of truth on them. And I think just today, maybe some of that light of truth, I heard that one of the decisions made this week by the Supreme Court had a fallacious foundation. It's probably going to have to be revisited. But it didn't come to light until after they made their pronouncement. Equality before the law must become a fact as well as a theory before America is truly the land of the free and the home of the brave. Now, why am I raising this one? I raised this one because I think we need to keep this in our forefront as we hold our elected officials accountable and make them do what we need them to do. The third point is, she said, I felt that one had better die fighting against injustice than to die like a dog or a rat in a trap. You ask about ground game. I would like to offer these up as part of our ground game.
I think that's a sound point. And I'd like just to make a point before Dr. Walk speaks and we open the mics. In looking at some of the historical things that we may have forgotten about, one of the worst things you can call somebody is a Nazi nowadays. And we say that the Germans did all of this bad stuff, but the Nazis got their philosophy from US policy. And they gave credit and awards to the people who founded the US eugenic movement. So this was what this country was founded on. They had us being 3/5 of a man. So we have to get rid of that racism and not be so concentrated that it's somewhere else is worse, but we have a history ourselves where we were sterilizing people, and some of these laws of sterilization, including in Virginia and Connecticut, they sterilized more than 50,000 people because they didn't want them in the gene pool of the white race. We also had a lot of ethnic cleansing here. We think that only happens in certain parts of Europe and Africa. No, it happened in the United States of America. Can we open the floor, Dr. Walks?
We can open the floor, Dr. Maxey. I think this is a very important topic. I think that as we look back at the history, it's important for us to. We actually talked about this today in church. The sermon had a lot to do with using our history and using it like a rearview mirror. We spend a lot of time talking about, oftentimes we will spend time talking about what happened back and how the country was built and what people did. And I think it's important for us to know our history, because we know all the comments about those who don't know history or who forget history are doomed to repeat it, et cetera. We know all of that, and we need to continue to know all of that. At the same time, we do have to have a ground game. We do have to understand how to look forward. I'm always happy on this particular broadcast when you, Dr. Maxey, and when others talk about the importance of voting, the importance of knowing who our elected officials are, the importance of as we are reaching out to interview the doctor that we need, do we know who our local officials are? Do we know who our council members, our mayors, in Washington, D.C., they have neighborhood commissioners. Do we know who our A1? Do we know who these people are? Do we vote for these people? As you said earlier, Dr. Maxey, it's important because those are the kinds of things that matter. And I'll just say this, and then I'll stop. When there is a new healthcare entity that comes in, Dr. Neighbor-Stevens talked about the importance of us being able to insist on or demand a change if we have a health plan, that there's supposed to be choice in the health plans. Those decisions about what's put into the proposed health plans that are in many of our communities, those are written by the local people that decide what the rules are going to be locally for health plans, what kind of coverage they have to have, what kind of access folks have to have, and what kinds of choice folks have to have. And so if you're waiting until you interview a provider to find out what the provider needs to do, you're at a disadvantage at that point, because you should know what the provider is required to do. All this information is public. The challenge is that either we don't know the information's available, or we don't think it's important for us to know the information that is available. So I would just encourage folks to be a part of what's going on in each of our communities, and then our nation and our world, so that we can know knowing what your rights are great. Knowing what's available to you is as important as knowing what your rights are. So I'll stop there.
Any questions in the chat? Anybody have a point they want to make?
Well, there is a comment that there seem to be more nurse practitioners than doctors available. Well, yeah, because we have a huge doctor shortage in this country. Maybe we haven't spoken to this enough, but there is a real almost emergency situation in this country in terms of the number of doctors in this country. And this is not a new problem. This problem was identified 20 years ago. And it has been, a lot of the shortage in the number of physicians is a result, again, of some misguided policy at the federal level that was not nixed when it was put in place. And that policy was to decrease the number of residency slots available in this country, because residency slots are those positions in hospitals and academic centers for new MD graduates. When you graduate from medical school, you get your MD, but you're not ready for prime time yet. And so what you need to do is go through a residency of your choice of the area of medicine that you want to practice. Well, those slots in the hospitals are paid for through Medicare. And there was this attempt, very strong attempt, to decrease the funding to Medicare. And where they made some very significant cuts, unfortunately, were in the funding of residency slots. So where we are now.
Speak to why they want to cut funding.
Because they said we were paying too much money for Medicare. They didn't want to pay, they didn't want to commit the part of the federal budget to Medicare. They were trying to cut.
Let's go back and look at where Medicare came from. Medicare started, I believe, in 1964. And it was touted highly by the National Medical Association, not by the American Medical Association. While it was just the American Medical Association, they were getting paid fee for service because Caucasian people could afford to pay that. When Medicare came in, because that's what the NMA wanted, it was good philosophically that more people that were Black could get care, but it created a giant, I'll call it a lion or a gorilla, that could ratchet down prices on the doctors. So part of the reason there's a doctor shortage, because you created an agency that could control them not making enough money, not having good lives, and a lot of people don't want to be doctors and go through all that madness anymore. So it's not just they didn't want to pay, it's the fact that you can't get paid, you have too much control, and people telling you how to treat people.
So Dr. Maxey, let me say something about where we are and what's available. We talk sometimes about the cost of going to college, about student loans, about going to medical school, and all of that is very expensive. And those of us that have gone through medical school and college, medical school, and a residency, it takes a long time. And it's a long time that you not only are getting into debt, but you're not earning. And so for a lot of people, this length of time it takes away from being able to support yourself, contribute to your family, and many of us have families as we go through. I was a single parent in college. Let's not even talk about after that and going to medical school and residency. We can discuss why I was a single parent, but that's a whole nother conversation. But it is amazing that we sometimes forget it takes a long time. So let me say this about the nurse practitioners and the other folks. And this may be controversial, but you can do a lot better with a caring nurse practitioner that's willing to listen to you and willing to take your concerns where they need to go than with a MD who is going to dismiss you because they only have 10 minutes and they don't really care about you anyway. They just have to see,
and don't forget physician assistants.
I'm sorry?
And don't forget physician's assistants.
No, nurse practitioners, physician's assistants, when there are, I don't think sometimes we spend enough time focusing on how important it is that the person who you go to see will listen to your concern, ask that second question that may take them a little bit longer, but may actually get to what you need them to get to. When Dr. Jordan, God bless him, we love him. He was so important in our community and in how we practice medicine. When Dr. Jordan would talk about you having a primary care provider, I would always hear Dr. Jordan talking about you having someone that you could go to with your concerns, who would listen and who would ask that next question of you and then take your concern where it needed to go. So I don't want to bash all of the different people that can help us because we're so busy trying to only get to the doctor. I'm sorry if that's controversial, but that's how I feel about it.
It's not controversial. Let's go to the next slide. I just want to bring up something else here.
This hour is flying. I can't believe it.
Yeah.
It's because I'm talking too much. I'm going to be quiet.
No, Dr. Walks.
Go to the next slide. Keep
No.
going. Go to the next slide. Next one. So preventative care is the best thing going. We know it's better to prevent something than to get something. So since the majority of our lay audience are adults, we know there's something called the annual wellness exam, which is a routine annual visit to your doctor to evaluate overall wellness and often includes a physical exam. You want to read this on Dr. Walks?
Sure. Prevention care. Point 1 includes a range of services such as an annual wellness exam, which is a routine annual visit. I want to emphasize routine annual visit. Ain't nothing got to be wrong. Routine annual visit to your doctor to evaluate overall wellness and often includes a physical exam. Your doctor may check your heart rate and blood pressure, listen to your breathing, test your reflexes, and check your skin for irregular moles. Blood pressure, diabetes, and cholesterol tests are usually performed there. Immunizations, like your yearly flu vaccine, and for some of us that are a little bit less young, your pneumonia vaccine, some other things that that the doctor may do during your annual exam, or your provider may do. Cancer screenings, such as mammograms to screen for breast cancer, colonoscopies for colorectal cancer, and pap smears for cervical cancer.
Next slide. So I
Do you understand the words that are coming out of my mouth? Do you?
So it's very important that you communicate. I think there's a slide before this. Is there?
No, I think this was the next. This was the next one.
Okay, but I looked up a list of things, the 21 questions that doctors wish you would ask them. After you tell the doctor what you think is bothering you, it's important that you find out, did he really understand what you said? And that's a back and forth discussion. Doctor, I told you that I hurt on my left side, not down my toe, but tell me about this, address it. Next slide. There's something called the 4 M's, the medication, especially for seniors. Let's go to this one, Dr. Walks.
Medications. Will this medication interfere with my everyday life? Is this high-risk medication necessary in the long run? And can I add, Dr. Maxey, I say this all the time to my patients. Every time, every doctor ever prescribes any medication for you, understand what the medication is for, understand how you are going to know if the medication is working, what's it supposed to change, what's the difference the medication is supposed to make, and understand how you will know that the medication is working. How will I be able to tell? Will my blood pressure come down? Will I stop feeling this ache or pain? Because it's important not only that we do what the doctor says, but that we agree with the doctor that we understand what the medication is going to do. I think this is so important that we understand medications and what they're going to do. I can go on and on, but I'll stop. Mentation. Will this treatment cause sleep disruptions or increase the risk of delirium? I dealt with this one with my mom a week and a half ago, and I can get into more of that if anybody wants to find out. But this whole thing about what medications are given for and what medications can do that they're not being given for is huge. This mentation issue, especially with those who are less young and who may be more susceptible to the risk of delirium. And what is that? It's when you are very much detached from what's actually going on around you. That's a simple way of saying it. Mobility. Will I feel alert and steady throughout the day? Am I going to take this medicine and stand up and fall down? What matters most? Will the treatment align with my specific goals and care preferences? This is important. Sometimes what the doctor thinks is the most important thing to treat may not be the thing that you think is the most important concern that you have. And so that back and forth that Dr. Maxey mentioned is critical in terms of you and the doctor agreeing on what matters the most.
What happens a lot in my office with my patients that are African American, they do everything I tell them to do, and they don't ask me any questions. And when my white patients come in, they have a list of questions. In fact, I get upset they ask so many questions. It's important. The more you ask, the more you know. The more the doctor thinks that you're on your game, the more they're going to be on their game. I'd like to see if Angela Moore would comment. She's the caretaker that worked with me for the past 20-something years. Can you unmute Ms. Moore?
Hello?
There you go.
Hi. Hi, everyone. I'm Angela. Yes, Dr. Maxey and I have been working together, and mainly I do house calls. What patients have come up against lately, I think COVID had a lot to do with the mass consolidation of healthcare systems. And I think the part we're leaving out is the corporatization of medicine. And that's really what you're running up against, what we're running up against, what patients are running up against. When I refer them to specialists a lot, they do have to wait 3 weeks, a month, 2 months. And I think if we don't address that, corporations have infiltrated academia and they basically run the system. So yeah, I have patients that are have been converted to plans without their knowledge. People that want me to see them and they don't have Medi-Cal like LA Health, and they are so intimidated by the process. They can't choose another. They don't know how to choose another doctor. There's a PCP assigned to them. They may or may not be able to see that PCP. It's all kind of hoops that they have to go through, and they're intimidated anyway. Most are illiterate. As I was saying earlier, the caretakers now have to be surveilled. They have to have downloaded app. My patients are calling me this morning about this. They have to download some app where they can be, the satellite can ping where they are, that they're in that house, or they went to the store for the patient, et cetera. So you have this other level going on. And the one-on-one is great if you can get it. But, at the end of the day, corporations have infiltrated everything from auditing to auditing us, Medicare fee-for-service people, just across the board. So I think you have to understand what happened during COVID was this mass consolidation, which is why you're having more high-tech, low-touch medicine being practiced. There's a wall there. You call. I'm having a hard time, and I advocate for patients, and I get a wall. So I can only imagine what patients are getting. So that day of, Dr. Maxey, patient coming in, having a true relationship with the patient, that day it's over from what I can see. And I'm on the ground. I'm in the gutter. I'm in the street.
Okay. I'd like to recognize Dr. Anna Quincy if he's on the line, and then Dr. Goffney for comments as practitioners to give more advice. Can you mute Dr. Anna Quincy, Dr. Nwachukwu?
Hello, I'm here. Thank you for doing a good job. I'm listening.
Well, thank you. Tell me a little about what you do. I know you have a big health plan that you put in Los Angeles, takes care of a lot of people.
I'm the chairman CEO of Global Care Medical Group. IPA we have 5,000 doctors, 500 primary care sites and hospitals. We provide comprehensive care. We're expert in healthcare delivery, and we're doing it since 1990. We've been doing this for a long time. We're one of the biggest medical groups in the area, and we take the core of our business is Medicare, Medicare, and covered California. We do private insurance, but that's not our strength. Our strength is medical and Medicare. And we are the one protecting the community. Everybody wants to come into South Central and Compton and Hawthorne and downtown. That's where the business is. I know some of our Black doctors all want to be in Beverly Hills, but there is no business there. So the other people are opening up community health centers, FQHC, in our neighborhood, but our doctors are asleep. Our doctors are asleep. Other people are opening up FQHC all over the place, and there's big money there. I'm too old to get into that, but if I was a young doctor, I would get into FQHC. The government gives them $1 million or $2 million free money every year, and they just hire doctors, hire everybody. If you have young doctors here, I would tell them to look into it. For me, I'm too old for that. That's for the other generations, but the business is in our community, and a lot of our people don't know that. They're looking for somewhere else. Where they're looking, there is nothing. They're looking to Santa Monica, they're looking to go to Beverly Hills. You're just wasting your time. You'll be paid high rent. You will pay high rent there. There's no patients. Everybody wants to have a movie star patient. There's not a lot of them, but where the patients are is in South Central, Inglewood, Compton, downtown, Hollywood, Torrance. That's where the patients are. That's where we need to focus. That's where we make more money than those people who are in Beverly Hills, I'm telling you, because for me, it's volume. We control thousands, 500,000 patients. We have the volume. It's like in business, you have low-cost strategy, a high-cost strategy. For me, I focus on low-cost strategy where the volume is. Because when I started that, I didn't have any mother or father to bankroll me, so I went to where the patients are.
So what advice do you have for patients in the current environment to get better care?
I mean, we're doing everything, the same care that people in Beverly Hills get. We're doing it in Watts and Compton and Inglewood. Tell me the standard of medicine. That's what we're practicing for low cost.
Thank you so much.
Yeah.
Any other questions in the chat? Dr. Neighbor?
No, but Dr. Sherrod has had her hand up for a while.
Okay, let's get Dr. Sherrod on. And I saw Dr. Gaffney too.
Oh, thank you. Good afternoon. Again, I commend the Black Health Trust on choosing this topic today. Genius, Dr. Maxey. There are several comments that I'd like to make. One, concerning what Angela was talking about, the corporatization of medicine has changed the delivery of healthcare. The focus now is really on money, the bottom line. And physicians only have like 15 minutes with patients, so they don't have a whole lot of time to deal with you because they have to meet a quota. And so it's even more important to have your list of questions, as Dr. Maxey has said, when you go to see the physician, and also to have an advocate, to discuss your problem with an advocate or somebody else so that they can actually assist you in asking questions. Because I think it's very difficult when you're ill to think straightly because your brain is not functioning as well when you're not feeling well. So if you can take somebody to the visit with you, I think that will help in many ways. The other thing is the quote by Dr. Martin Luther King. That's why I think this session is so on point today. And that is, he quoted that, it's often said that he quoted that injustice in healthcare is the worst type of injustice because it is inhumane and the consequences is death. And death is the most radicalized, the worst radicalized consequence of injustice. And so the other thing, though, I want to commend Dr. Maxey on is when he put up the 4 M's, you sounded like a functional medicine doctor, because that's what it's all about. We don't realize that we're actually trained to, there's a lot that's left out of our training. I'll say that. We're trained to dispense medications. And sometimes when you dispense medications, it puts the patient in the bed. They can't function. The whole idea of going to see the doctor if you are ill is to be able to do things a little bit better than you've been doing them already. So those 4 M's that you put up there are just so relevant. And I was at the Drew Society meeting about a week ago, and I didn't really get a chance to express, because we have the new Drew Medical School, now, and they put the curriculum up. My question was, are you including some of these things like those 4 M's that Dr. Maxey talked about, so that we are teaching our community functional medicine, so that our patients are not just on drugs and in the bed and not functional? You understand what I'm saying? So they gave the curriculum, but there's nothing on diet and prevention, which are key elements, I think, in our community.
There's a point I'd like to bring up that I thought you made that was so important, and that is the one of an advocate. I read an article just a few days ago about a certain local hospital that's run by a company called Prime Care, which is in Inglewood, California. And they got investigated because a young 34-year-old lady died in childbirth. And it turned out that they had not done anticoagulant precautions for her. She ended up having a blood clot. The crash carts weren't good. So whenever you go to the doctor's office, but especially if you ever have to go to the hospital, you must take an advocate. Somebody can look out for you.
Right.
It may not be an honest situation where a patient would know, but we've got to know what to do, and we got to protect ourselves. I remember I went to the emergency room one night for me, my son, and his girlfriend went with me. They wouldn't let anybody touch me without explaining what they were doing. And I'm a doctor, I'm supposed to know, but when you're sick or something's going on, you can't always advocate for yourself. So having somebody with you, just the fact that they're there, makes people more forthcoming to get you what you need. I know we're getting it close to the
Yeah,
hour.
one other point, Dr. Maxey, and that I want to thank Dr. Anna Quincy for his discussion on his healthcare system that he's implemented in the community. I worked with Dr. Anna Quincy when I first got out of UCLA. I met him through Dr. Enrique Logan, and I used to moonlight in his office. And I'm just wondering whether we can ask him to give a course to the younger physicians about the opportunities which he has taken advantage of, which would be, I think, beneficial for our community. Thank you very much. Wonderful session today.
Thank you.
We have
Stephen?
Dr. Maxey, Dr. Lawson has been waiting to comment for a while and did put a couple of their comments in the chat.
Thank you, Dr. Lawson.
Thank you very much. Can you hear me okay?
Yes.
Sir.
Yeah, great session. I just want to note that the discussion about the workforce issue is actually much worse than that. If you want to be able to demand a provider who's your same ethnicity or gender, it's almost impossible in some areas. I just recently found out I'm from the second fastest growing city in the country. But when I left, I was the only male African-American psychiatrist. And that's true for many other places as well. So we need to look at some of the techniques that's already been described to increase real access, which includes utilizing modern technology, such as remote provider care and others. Second point is that many of the points that you made are very good to address knowledge that we have, but we also have a lot of health ignorance because we don't have investigators who've looked at many of the issues that is involved in terms of healthcare, basic science and knowledge. Our knowledge system is based on the interest of the investigator. And if we do not have African-American investigators, we do not look at those issues. And our communities simply do not have the resources to do large-scale clinical trials, do pharmacokinetics and so forth and so on. So often, even our best providers are literally working in the dark in terms of addressing our concerns.
Amen.
Thank you so much. So where's our famous doctor from Maryland, University of Maryland?
One of them, because the University of Maryland puts out a whole lot of great doctors, but
Dr. Stephen P. Thomas.
Dr. Hines is not with us today. You have
No,
somebody
Dr.
else
Stephen P.
online?
Thomas.
Okay.
I don't see the barber poles.
I
He's
do.
on,
No, Dr.
Dr.
Thomas has something else up today.
Yeah,
I
he's
see.
on.
Stephen P. Thomas, PhD. He's like you, Dr. Maxey. He put he signed in, but then he went to get a snack. So he's not available to us right now.
I always like to hear from New Hampshire.
Well, hi, good afternoon, Dr. Maxey. Great subject today. I could speak for the next hour about advocacy. Having been recently in the hospital and having to contact the hospital administrator on duty. No one has mentioned that here, but when you're in the hospital, every hospital has a hospital administrator on duty 24/7. And his job is to make sure no complaint reaches the CEO of the hospital. So if you have a problem at the hospital with your physician or the nurses or whatever, just ask to speak with the hospital administrator. And I promise you, you will be satisfied with the result. And I just wanted to get that in real quickly before we, as we close the hour, but I could go on with this subject for another hour with you. And I hope you bring this forward again, because finding a PCP and going through that process is something I did this year, being in New Hampshire as a new patient. And I can tell my tale and what I've learned from it and share it with others, but we don't have the time now at the top of the hour. But I thank you for bringing all this forward. Terrific. Absolutely great today.
Is Miss Tanner on?
If we can unmute Ms. Tanner.
I'm going to
There we
unmute
go.
my daughter, but there's Tanya that you want to unmute. She's my daughter that wrote the letter.
Can we unmute Tanya?
Thank you, Ms. Tanner.
Well, thank you. I appreciate you guys acknowledging my concern and speaking on the subject. Being an advocate is a family trait, I guess. You unmuted my mother first, but she's like the advocate for everybody in Minneapolis who's Black. If anybody goes to the doctor, my mama, they're always, what should I ask them? Come with me, or this, that, and the other. So she has been an advocate for a long time. And her mother was an advocate in New Orleans. So we just have been an advocate family, I guess. And I know I hear you guys talking about all these subjects, and I'm still sometimes nervous about what to ask the doctor. So that's why I brought the question, because I don't have a medical degree. I can keep asking questions, but if they keep telling me it's okay, then I don't know what more to do. So, and
It's
like
never
someone else,
okay. Tell them I'm uncomfortable. Tell me what else. What can I do to protect myself?
okay.
And the other thing that people in our age group, not you sound very young, like a teenager, but the rest of us, we need to talk one of our sessions about advanced directives. Sometimes that can end up very tragic if you don't have advanced directives, and we've had to keep people on respirators and in a lot of painful situations because they did not have advanced directives about what they preferred to do at the end of life. So that's the subject we have to bring up. Is there anybody else non-physician that would like to have a word before we?
I'm a non-physician, and
Go ahead.
I'm honored that the physicians allow me among them. I like to think that what I do can help physicians do what they do better. So I'm just so happy to hear this conversation about advocacy. I had to switch my background from the African village teacher to the barbershop because that's exactly where I think we could have more advocacy to support people once they come from the doctor, to have a space where they can unpack it and then get encouragement. Hey, I might have to call
Historically,
Dr.
barbers were
Maxey.
surgeons. Did you know that?
I know that history, but one of the things, Dr. Walks, is they now know their lane. It's very important that we have people that don't overstep. And by getting them trained as certified community health workers, as mental health first aid and lifestyle coach, now they kind of know their lane. And when the medical professionals come in, they can now have common language a little bit better. So you're not asking people to develop an entirely new nomenclature just to have a conversation. So this is so important what's happening here in the Black Health Trust. Thank you so much. Now I'm out on the grill and I got to run back out there, but you see, I'm representing.
Yeah, get that apron back on so you don't mess up that wonderful shirt.
You got that right.
I'm down the street. I'm coming to get my barbecue.
Yeah. And the grilled vegetables.
There you go.
Is Dr. Goffney on and Dr.
Yes, Dr. Maxey, I'm here.
You care to say a word before Dr. Gibson says a word?
For sure. Just want to commend you on the topic. I think this is very important. I did want to point out, I put some things in the chat about nurse practitioners and PAs. They are very, very important, especially since they generally have more time than MDs to talk to a patient. And we all know the value of that, just having someone to listen. But their level of training certainly is not what the physicians have. And that can be problematic for the patient. They can be great advocates with a physician on behalf of the patient, but they should not be a substitute for a physician. I mentioned that I can give you many stories. You know, I'm a surgical oncologist. I can give you many stories of patients who just love their nurse practitioners, but things were missed. And I think if those very patients had been seeing an MD on a regular basis, that those types of misses would not have happened, and we would have had better outcomes. So I appreciate nurse practitioners, but in California, after obtaining a nursing degree, they only have to do 6 months of specialized training to become a nurse practitioners, and that allows them then to put up a shingle and operate independently, really, of MDs. They can write prescriptions and the whole bit. That's problematic for us. It's a consequence of the corporate takeover of medicine, and all that is to the detriment of patients, I believe.
Okay, I'm going to take issue with some of those things, but not today.
Yeah, me too.
But not
I
today.
do too.
Who is that?
This is Trisha.
Hi, Trisha.
Hi, I'm a
good.
retired public health nurse, and I've been following this wonderful platform since its inception. And I was diagnosed in December of 2016 with pancreatic cancer. To God be the glory. And that's after seeing a couple of physicians, and it was my physician's assistant whom I had been a patient of and had a trusting relationship with for over 20 years. She and I together got me diagnosed. And it was Mayo Clinic in Rochester, my team there, as well as my team in Minneapolis, that I can, say that I'm cured. I'm cancer free. I've lived over the 5 years. Praise God. I certainly, my heart goes out to Angela. I have said to my dear friend Hazel, back in Minneapolis, my husband and I retired to the state of Mississippi, so we had to go that whole route of finding primary care, and I was terrified. I was terrified down here, but things have worked well. But I've said to Hazel, when the healthcare we knew prior to COVID is no more, and I heard Sister Angela say that today. It's no more, but I am hopeful. I am hopeful that Black Health Trust will help prescripting what we need to say. And what I have shared with my community here is, if you don't have, first of all, you don't leave the doctor's office office without asking one question. And if you can't think of anything, ask, okay, so I hear you say ABC. How does that fit in the plan of my care? And Dr. Walk said last Sunday about how, it's imperative on our healthcare providers to not allow us to leave until they've broken it down to where we understand it. And I share with my family members here and charge them, you need to sit at the head of that table and you're the conductor. You have a team and you ask questions. I could go on, and I'm going to stop. But I thank you for this topic, and I thank you for this platform.
And thank you so much, and bless you for your cure.
Yes. Yes.
And I know we're well past the top of the hour where we said we'd close this out, but I want to open it up one more time to some non-physician to make a comment or ask a question.
I'm a non-physician.
Right.
There was a recent move to change the names of PAs. We're now referred to as physician associates. Just putting that out there. I just got the notice last month. Again, we're physician extenders. I don't move outside of my lane. I don't want to move outside of my lane. I think a lot of people don't know the history of PAs. And basically, we came out of Duke University following the Vietnam War. You had a lot of medics in Vietnam that were taught very practical applications. And there was pushback from doctors who thought that we were a threat. We're not. We don't have the extensive education that you do. But again, insurance companies write our healthcare policy. And I think if people can just get that in their head, I think we need to, kind of get that in their head and either be okay with it or change it. But that's where we are.
And let me say this. I'd put Ann's up against any physician I know, and she'd be in the 99th percentile. And I've known that. She's super smart, super caring, and she's actually my primary care doctor. And I'm an MD.
I know. Thank you.
So Dr. Maxey, you had mentioned unmuting Dr. Gibson earlier, and I know that Dr. Gibson put in the chat that he is still muted. So if we can get his comment before we close out.
Okay.
Thank you, Dr. Walks. I have just one comment to make it out of an abundant respect for everyone's time. Please, please, please take advantage of proximity you have to your local pharmacist, because business is at the heart of the practice of pharmacy. It's just the nature of the beast, and we are numbers, individuals, and we understand the corporatization of medicine. As unfortunate as it is a reality, and we just need to use all the resources that we have at our disposal to formulate the plan, because you got to have people don't plan to fail, they just fail to plan. So if we talk to the pharmacist, develop a good, solid relationship with your local pharmacist, that can be another resource, like the promotores, the nurse practitioners, physician's assistants. All of us play crucial roles, and we're here to help, and we're needed more than ever before. I really wish there was time for me to talk about what we must do for HBCUs, even though I didn't have the luxury of being a student at an HBCU. We're going to do something about the HBCU situation now, more than ever before.
Good point. Good point. Can I pick on a name I see named Rose? Rose, do you have a comment you'd like to make? No?
Hi, can you hear me?
Yes.
Oh, well, I wasn't really prepared to say anything. I would just like to say that advocacy is imperative. That was an excellent point that Dr. Sherrod made. And I too am concerned about the corporatization of medicine. And I think we have no idea what we're up against. And I think everybody just needs to be very watchful also about the implementation of AI, artificial intelligence. We don't know how that's going to impact medicine. So I would just suggest people be very vigilant and definitely find a doctor who you can talk to and who is not talking at you. Make sure they're looking you in your eyes. And that is a key point. If they can't even look at you, then they don't care about you. And don't hesitate to switch. You're paying them. So hopefully you can keep some of those things in mind. And, you know, the future is here now, and we don't know what we're up against, but just stay vigilant and watchful. Thank you.
Well, thank you so much, Rose. I see a name named Alice Tobert. Is that by any chance Dr. Coombs?
Yes.
Harry, I'd love you to make it.
Yes. Well, I think the program today was fabulous. I love the fire in the belly. I put my comments in the chat. My minister preached today. It was a powerful message on game changer and how the very adversity that we're facing right now as a result of the Supreme Court findings and hearings and results in terms of what happens to African Americans and Latinos is the very thing that will galvanize us to be better at really being creative in terms of initiating some actions that are going to make a difference. But for me, the burden for me is the next generation. I see the pipeline as the way we should focus a lot of our energies. They can't get to college and be successful without SAT and MCAT preparation. So we got to do something about pouring money back into the next generation. We need to touch the well-endowed individuals who are in entertainment to say, we got to do something in terms of, I love the KIPP school, but we got to do something even greater on a larger scale nationally for our pathway for excellence for our students. And we got to do it and have dogged determination. So thank you so much. I really enjoyed this. I had my whole section at MA. I sent them emails, but I'm going to send them next week, kind of like what Jesse Sherrod does. Jesse, thank you so much. Also for sending out the emails, but I'm going to do that. I'm going to commit to do that for next week as well. Thank you.
Thank you so much. I'd like a comment from, I saw a name, Zenobia. I hate to embarrass people, but I want them to comment. Is Zenobia still on?
I'm not seeing that, Dr. Maxey.
Okay. Okay, then why don't we go to our final comments, starting with you, Dr. Walks, and then Dr. Nabert.
Dr. Maxey, I have so many things I want to say. Whenever we talk about, I want to just go back to your iceberg slide. I think it was your first slide after you introduced the topic about all of the things, all the factors that contribute to our current state of play. I think it's important for us to recognize that healthcare and health status, health disparities are not in a vacuum, that our society does contribute in so many ways. I think the Supreme Court decisions, I'm going to try to make this as short as I can. I think the Supreme Court decisions assume, and people assume, that there is no underlying problem. The fact that there's so many things there, you can't get reparations because everybody thinks everything is fixed. I think everything is not fixed. I think a lot of things are not fixed, and the Supreme Court decision would make a lot of sense if everything was fixed, but it's not. And so it's important for us to remember that the fight goes on. The efforts need to, as they always have, include people who don't look like us. I love the fact that your friend from New Hampshire, my friend from New Hampshire, is always on, because we have never lifted this lift by ourselves. And we have to make sure that we are working together as a part of the only race on the planet, the human race. So we have got to remember to include everyone in this struggle, because it is a struggle for all of us, as was mentioned earlier. And then I think that the last little bit I want to say is that for now, because y'all know me. The last little bit I want to say is this. I respect absolutely Dr. Goffney's comments about some of the experiences that he's had with folks who are not MDs. And I respect absolutely Angela and others who have commented on the importance, including you, Dr. Maxey, on the importance of folks who are not MDs, but can actually be. I think Angela said the gutter. I think she meant the ground. She's on the ground. You ain't in the gutter, sister. She's on the ground.
I'm in the gutter.
Lifting us up out of the gutter because
I'm in the gutter. Social economic. I spend so much time with food banks and trying to get people's money and access and transportation, all these social economic issues that no one considers. Generational issues, mental health issues in the family, the 3 generations in one house, 2 generations in one house. Just the economics of it. It's like, I don't know, I don't know. The kids are like, we only can have gig jobs. I can't afford to go to college. I mean, it's just all these issues.
I love the passion, and I share the passion. And it's important that we recognize that there are folks who are willing to get out there and do the work. And a lot of times those are some nurse practitioners, some MDs, some PAs. And there's a value to all of these different levels. And I think that we don't have to discount one in order to highlight the other. When you go to see someone who has spent time in fellowships understanding a particular kind of cancer, and those people are willing to work with you and help you with that specialized treatment, you get stories like our sister Trisha gave us today. So there are all of us needed in this fight, and I think we have to just lift each other up. Everybody can't spend 12 years trying to get an MD. The family can't stand it. Their responsibilities can't stand it. So I just think that from Dr. Thomas, who I used to like until I realized that he wasn't inviting us to his barbecue he's having. Now I got an issue with him. But Dr. Maxey, this is such an important topic. We have to keep lifting up the opportunity that we have to struggle and to vote and to support each other and to advocate, all of that.
Thank you so much, Dr. Walks. Dr. Barbara Nabin-Stephens. By the way, Dr. Stephens, there are 2 people on this Zoom call that I met when they were 16 years old. You're one, and the other one was Angela. 2 of my favorite people.
Thank you. Well, I'm going to close with where I usually close, which is to use common sense. Yesterday, about 5:30, I was driving down a road here in Nashville that really there was almost no traffic. And I noticed this car was approaching me, and he was going further and further over the middle line. And so I was going further and further to the right, trying to avoid colliding with this car. And this was at 5:30. Heaven help us today and tomorrow and Tuesday. So use common sense and be careful. Then I heard the tragic news of what happened in Baltimore. You know,
what happened in Baltimore?
28 people were shot, 2 were killed at a block party in the Brooklyn section of Baltimore.
Wow.
I understand that people want to move around. I understand the concept of having fun. But in this day and time, let me just reiterate, use common sense.
Amen.
Thank you, Dr. Barbara Nabin-Stephens. Well, I appreciate everybody joining the discussion today. I think it was enjoyable, and we'll try to keep doing discussions like this that are more relevant to everybody on the line and communication. I'd like to have a less of a distance between the medical trained people who are on the line and the lay people on the line. I want us to all be part of a growing community. Everybody enjoy their Sunday and keep pushing. This is our country, and we want to be woke in our country. Woke meaning you know what's going on with yourself and around you. So some people don't want you to be woke. We need to get rid of those people. Everybody have a good Sunday. Happy 4th of July. But more than that, happy Juneteenth.
Absolutely.
Thank you.
Thank you, Dr.
Bye.
Bye.
Bye-bye.
Hi, everyone.